Hi everyone, welcome to week 5 of the Psycholective. I hope you guys are enjoying the beautiful weather. So I just wanted to give you an overview of what you'll be doing this week, plus comment on last week's discussion boards. So actually, why don't I start with last week's discussion boards? So the first topic I had you guys learn about was the role of potential psychedelics and hallucinogens kind of making a comeback as potential treatment for mental health conditions. And so your discussion boards are really great. Overwhelmingly, you all seem to agree that there is a potential for medicinal use of hallucinogens in psychiatry. However, you guys also raised the caveat that there's still a lot of research that needs to be done. The studies that have been done and have shown some positive effects in treatment tend to have smaller sample sizes, not a lot of randomized controlled trials. And then the other thing is that, a lot of you noted that this kind of therapy would have to be conducted in a very controlled setting. And I think that's an important point. You're absolutely right, especially with, for instance, the MDMA and PTSD. Those sessions are all-day sessions for patients. They have to have a specialized room that they're in with equipment and specialized and specially trained personnel, nurses and other staff that are there with the patient. So if that's the case and that's how we're going to carry out the treatments, even if they're effective, what is the feasibility of actually being able to use this in practice? So do we have a space to create rooms like this and resources to create, the setting that we need and then the additional training? So is this feasible in practice? And how accessible would this be for everyone? So is this something that people in rural areas would have access to? What about people that live in remote areas? How would they, would they be able to benefit from this? A couple of other things I just want to, point out or keep in mind is when it comes into the psychedelics and as potential medicinal uses, I agree with you guys that there is a potential for medicinal use. However, I think it's important for us to always ask the question with any medication or drug is, what is it exactly that we're trying to treat? So are we trying to short-term treat symptoms of the condition? Are we trying to get at the underlying mechanism that's contributing to the pathophysiology? So even if taking LSD or psilocybin makes somebody feel, less anxious, how is that any different than drinking alcohol? When used in combination with a type of therapy, that's where you could say this could be a difference, that it's actually aiding in the therapy. And a lot of the stuff that you read about MDMA, and some of you commented, was that it opens the patient's mind, allows them to connect with their trauma. As a biological neuroscientist, for me, I don't know what that means. What exactly is that drug doing in the patient's brain to allow them to connect with their trauma? And unfortunately, the thing that these trials don't tell us is exactly how that's happening. It's still a black box. And I'm not sure how many of you are familiar, but the FDA doesn't require proof of mechanism of action for new drug approval. So it just needs to show that it is capable of significantly reducing symptoms, clinical symptoms, but not how it's doing that. So that is one of my caveats with this type of research. The other thing to consider is the trials that have been published. Are these positive findings? So how many trials that didn't have positive findings were not published? And who is sponsoring and publishing these trials? So for instance, the MDMA trials are largely sponsored and published by MAPS, which is the group that has an invested interest in this working and being successful. So these are just a couple things I want you to think about as just playing devil's advocate, but you had some really great responses, and I think you're right. There's a need for new treatments and new ways of targeting treatment-resistant disorders. And what we currently have isn't cutting it. So we do have to take, other avenues. And this is a potential promising avenue. For your second discussion board, we discussed the first generation versus second generation antipsychotics. And the topic that this was related to is the drug-induced movement disorders. And so this is a major issue, especially with these antipsychotics. So for the majority, everybody kind of had said, I would lean towards second generation versus first generation antipsychotics. And I think your arguments for it is, having less movement related side effects for the second generation is well taken, and that's a good point. However, several of you did mention that the second generations aren't without their own side effects. So there's concern about metabolic side effects. And several of you even pointed out that the efficacy between a first generation and second generation antipsychotic really is no different. That they have very similar efficacy, but when it comes down to it, it's their side effect profiles that differ. So whereas first generation is going to be the movement-related side effects, your second generation is going to be metabolic side effects. And one of your classmates had made a comment that depending on the patient, and a lot of you had said depending on the patient, you would go with a first or second. But one of your classmates had specifically said that, for instance, if you had a patient who was elderly and there's a high risk of falls and so forth already in that person, perhaps a first generation antipsychotic wouldn't be the best idea. And on the other hand, if you had a patient that was diabetic or overweight, that perhaps a second generation antipsychotic would not be a good idea. And I thought that was a very thoughtful response, and that was excellent. So great job. So I hope you enjoyed kind of learning about that. And if you got a chance to practice the AIMS assessment movement questionnaire, that is something that you'll probably come across even if you're not a psychiatric pharmacist, but it is something that happens in primary care. Those assessments are pretty common. Okay, so for this week, we've got new topic. It's about psychotropic use during pregnancy and breastfeeding. So I've included a really nice systematic review about prescribed psychotropics during pregnancy. So pregnancy, neonatal, and childhood outcomes. And so it's a longer paper, but it's very thorough, and it I think is a great kind of overview of everything. I've included a podcast. It's an interview with a woman, a doctor, who describes a case with a pregnant patient, and kind of her approach to treatment with that patient. And then there's some discussion about the risk-benefit ratio of psychotropic use during pregnancy. I've also included then the guidelines for psychotropics in pregnancy. This is just for your reference, so it's not, you don't have to read it, but guidelines are going to be a good resource for you. These guidelines, interestingly, haven't been updated since 2008, so just kind of keep that in mind. And then there's a discussion board that's called "To Continue Paxil During Pregnancy or Not?" That is the question. So I am posing a patient case of a woman who is pregnant and is currently on Paxil, and her doctor is not sure if they want to continue her on Paxil because of potential risk to the baby, but the patient is concerned about her own symptoms coming back and so forth. So it's basically, I've divided you guys up into a for and against argument. So your last names are listed under which argument you've been assigned. So if you've been assigned for, you need to provide an argument for continuing the use of Paxil during her pregnancy. And if you're under the opposite side against, you're going to provide an argument why we should not continue Paxil and perhaps what we should do instead. And for either side, I want you to provide support for your arguments. please read each other's responses. However, I'm not requiring you to respond to a classmate's post, but please read each other's different viewpoints, because I think you're just going to be able to get a better overview of information, and there might be things that you missed in your own argument. Now, the argument, the side that you've been assigned might not be consistent with your own kind of belief right now, but that's kind of the point of this. This one's a tricky one. There's a clinical and ethical sort of challenges related to this problem. Okay, so it's not necessarily easy for one side or the other to argue. Okay, the second topic this week is going to be our second live session with a psychiatric panel. This is going to be the Microsoft Teams, so I've sent the invite. I will send out the link for the Teams meeting, again, via an announcement, just in case you didn't get the invite or have difficulty connecting. Again, this is required. We're going to have 3 panelists, and they're they're all pharmacists, but they have different areas of expertise in the realm of psychiatry. So one of them is an associate professor from our department, Dr. Kyle Burkhart, and he studies a lot of the pharmacoepigenetics, insulin resistance, metabolomics, and so he's going to talk to you, or he's coming from the perspective of researcher in psychiatric pharmacy. Then we have Dr. Sarah Goldsborough, who is a pharmacist, and she is a clinical pharmacy specialist in psychiatry at Beaumont Health. She works in the inpatient psychiatry unit. She's board certified in psychiatric pharmacy. And so her areas of interest include transitions of care, schizophrenia, patient education, and major depressive disorder. And then finally, we've got Dr. Joseph Cusmano, and he's a second-year pharmacy resident in psychiatry at Michigan Medicine. And so he has interest in psychotropic therapeutics, psychedelics, and suicide prevention. So this might be an opportunity for you to talk more about psychedelics with someone. But basically what we're going to do is we're going to, this is an opportunity for you guys to ask questions of these panelists and kind of learn more about how they got into what they're doing, maybe what their career is like. Ask anything you really are most interested in. So to prepare for this, and I'll send an announcement, I want you to read the panelist bios, which I have posted under this week's topic. And then I have a discussion board. It's not called a discussion board, but it says questions for the panelists. I want you need to submit one question that you would like to ask the panelists or would like the panelists to answer. And it can be for a specific person. It could be for all of them. But I want you to submit at least one question so that we have something prepared and we're not just kind of sitting there staring at each other and nobody's asking anything. So if you could do that, submit your question before 12 o'clock on Friday. That'll give me enough time to put all the questions together before we begin at 12:30. Okay? And then lastly, for that, you'll do another kind of reflection on the psychiatric pharmacy panel, just similar to what you did with the student wellness. All right? All right. Well, I look forward to seeing you guys on Friday. Email me if you have any questions. Take care.